consider how the city of Lewis should respond to the coronavirus epidemic. Now, I think I try to keep up with things. I called into the state call today at noontime. It was a little difficult because they sent out the wrong passcode. We finally got it, but the background noise was so bad that I really couldn't hear very much, except to say that we can assure you that the testing that's been done in Delaware has been done on 20 plus patients. They've all been negative. But the other thing to keep in mind is the fact that the state lab has only 300 test kits. They're expecting more, but at this time they have only 300 test kits. Now, each test has to be approved by the Department of Public Health before they'll test it. So that an individual physician needs to call the Department of Health to get permission for this test. Now, there's some private labs that have developed the test, but at the moment, the accuracy of these tests has not been determined, nor has the turnaround time. Whereas the state turnaround time should be within a day, you'd have an answer back. Now, what the Board of Health here, we want to just consider what the problems are and what's happening now, but we're in a position only to make recommendations rather than to say, you know, things need to be banned and this and that. That's not our job. Our job is to make recommendations, and then we'll go from there. Now, Ted Becker did send me today a note from a paper from the town of Georgetown, who has developed some rather liberal job sick leave policies, and suggested that we might want to consider that. Now, keep in mind, though, that it's not been adopted. It's only been proposed and must be acted on by the town council before it becomes effective. Now, what I'd like to do is to talk about some of the things that we can do locally for containment. And part of that is something called social distancing, which I'm sure you've all heard about, which means, you know, no hugging, kissing. Really, we shouldn't be shaking hands, although I notice the president still does it. And then we have to be aware of hand hygiene. Now, they're recommending that we wash your hands for at least 20 seconds. My understanding was that 30 seconds was the recommended time. Now, as a surgeon at the hospital, we scrub for 10 minutes before we entered the operating room. But that's, and still, you have to remember, infections crept through on occasion. Now, the other thing that we need to do is to suggest that the people that sneeze or cough into preferably a tissue, which they'll then discard. Now, I don't know who's going to pick up the discarded tissues, but that's beyond my thing. One other thing that I think we need to keep in mind is that at some point, our EMS personnel might all be, or the majority of them, contaminated. And we're not sure what we would do for backup. Now, I think Glenn Marshall from the Sussex County Medics is scheduled to come here today, and hopefully they'll have some sort of backup plan, because they've had a meeting at approximately 11 o'clock today. So hopefully they'll have a plan for that. I hadn't thought of that, but I don't know what we do if everybody gets contaminated. In any case, what we can do is encourage people to stay home if they're sick. And sick involves a fever, cough, shortness of breath, and the fever should be at least 100.4 or above. Now, you say, what's the difference between that and the flu? There's not a whole lot of difference. So what we may be experiencing is more of a flu epidemic than a coronavirus epidemic. And in the state of Delaware, we're having a fairly high number of flu cases recognized. We might encourage people to stay at home if they're sick, that is, home from work, home from school, or other gatherings. We might discourage large gatherings of people. Now, I'm not sure what involves a large gathering. Some of what I read said 1,000 or more, and the other one said 5,000 or more. So I don't know. Anne Marie brought up the point about the council meeting, but you have a crowd at the council meeting usually, don't you?
Right, so we are expecting a pretty large crowd at this next council meeting, and right now it's scheduled for the Rollins Center. So there are, I guess, several ways we can approach it. One would be to go as scheduled at the Rollins Center. Another would be to hold the meeting here, encourage people to stay home and listen to the live stream. We cannot live stream from the Rollins Center, but we can live stream from City Hall. And one option would be to cancel it. So I think we don't want to unnecessarily panic, but on the other hand, we do have a population where the median age of our community is in the high 60s, so we have a large vulnerable population here, and we don't want to put people at risk.
Glenn Marshall's here. He'd come up in front here. The other thing that I wanted to bring up is that we're encouraging rather liberal sick leave for employees. Now, as I say, the town of Georgetown has drawn up a thing that maybe we can follow if need be about liberal employee leave. But even that's not in effect as yet. It has to be approved by the town council. And I think part of our job ought to be to show that we're concerned about the coronavirus, but to limit any panic that might occur. And we'll try to do that. And what I would like to do at this point in time is ask Glenn, one of the things that was brought up by Ted Becker, he's down in Washington at the League of Cities meeting, was what do we do if the majority or a large number of our EMS personnel become contaminated or scheduled for quarantine? Do you have a backup plan for that?
So we do, both at the county level and local fire departments have a plan, right? So what we do is educate our people. They work every day with the possibility of infectious diseases. They go through mandatory training every year to remind them and renew any information that comes out. The other part of that is we have kind of changed our plan a little bit. When we come up to you as a patient, first thing we do is we start asking questions. And if you start displaying signs and symptoms of possibly having the flu, cough, feverish, we're simply going to ask you to put a mask on. It could be a non-rebreather mask for oxygen if you need that, or a simple mask. All that does is protect the particulates that would come out of that individual.
Ted, pardon me just a minute, Glenn. Ted, we're listening to Glenn Marshall now to tell us what to do if our EMS personnel become contaminated. And
terrific. Thank
so
you very much.
that's one of the things
I thank everybody for, I thank Dr. Marble for speaking this, and
Right.
also thank you all for your diligent work to help us develop a plan how to best address this. I think your opening comment regarding not panic, but certainly be prudent and we recognize what everyone's individual health concerns are is very, very important as people weigh how they want to move about to the public is concerned.
Right. Okay, Glenn.
Thank you. I'll go back to listening.
Sure, thanks. Thank you, Ted.
So we have been in constant contact with the state and local hospitals, and BB's representatives are getting ready to come in. So we work as a team throughout the state. It starts at the basic level with the fire departments and works up to the ALS level, which were separate entities, and then to the hospitals. So we're very cognizant of what's going on. We are paying attention to what's going on in the region around us, and we will escalate things as we need to, but at this time, it has not reached our region, and we are being proactive in what we do. As far as major changes to our practices when we go out the door to treat you, there's not a lot. We remind our people they need to be diligent in their skills as far as washing their hands and making sure they do that in between each patient contact, which they do on a regular basis. Again, we're just reminding our folks, but we do have a plan in place. If we do get affected by the coronavirus or any kind of flu epidemic, that would come out and take a great deal of our staffing out. So that would not change our operations. It may minimize the number of actual personnel that are on a unit, but we have a fluid plan that allows us to transfer a unit from one area to another to ensure the calls are covered.
Right, thank you, Glenn.
Yes, sir.
Cheryl, you want to tell us what's being done at the hospital to plan for the possible coronavirus epidemic, supposedly?
Yes, the World Health Organization just about an hour ago decided that they were going to call it a pandemic. We have actually been working on it for weeks now. When the first cases started to hit, we started all of our normal processes that we have. We have an emerging infectious disease plan at the hospital. We've had that for a long time. We were working from that. We also got a smaller group of people together, which has grown into a large group of people now. We were working on updates daily. We were getting subcommittees together to work on all of these. This was several weeks ago. We had already started with all of this because I'm the emergency management coordinator, and that's what I do. We have done many things, and I'm going to Marcina is going to talk too about all of the things that we're doing currently right now.
Sure. So,
Can I ask that everybody introduce themselves?
Yeah.
We have Janine taking minutes, so she doesn't necessarily know everybody's name
Hi,
yet.
Jean. So my
Cheryl
name is
Hopple.
Cheryl Hopple, Hopple, and I'm the emergency management coordinator at BB.
Marcy.
sure. Marcy Jack, I'm the Chief Quality and Safety Officer, MARCY.
Thank you.
Sure.
Do you have the other names?
I will get them.
Okay, all right. Thank you.
Okay, so,
Go ahead, Cheryl, I'm sorry.
Well, so we, Cheryl and I work very closely together, and again, BB, we practice and drill all sorts of different emergencies, and one of them is for an emerging infectious disease, pandemics as well, such as flu. We have a flu pandemic plan that we practice and drill, as well as we have resources that are devoted to emergency management, again, that we practice and drill frequently. That includes surge plans, so if we have, many people that come to the hospital, not just for some sort of maybe infectious disease, but maybe from exposure to hazardous materials or some sort of traumatic event where many people are affected, and, you may have an influx of patients. So this is something that we do practice regularly, just in case, and we're happy that we do that, because COVID-19 is not in Delaware yet, that we know of today from the state of Delaware call, but it probably is coming, and we definitely do need to be prepared. BB has been actually on calls. We have calls weekly with the Department of Health. We talk to their infectious disease professionals regularly. We have infection prevention nursing. We have an infectious disease physician, Dr. Chazanoff, who is sort of the head of this at the hospital, and really we've been devoting resources full-time to this to make sure that we're prepared. We look into our personal protective equipment for our staff. We look at patients and screening procedures and how we can care for patients, looking at families, and certainly looking at our community. And also a big part is education and awareness. So trying to get information out. The BB Healthcare website has information on that. from BB. A lot of that links to the CDC and the state Department of Health, state of Delaware, as well as the WHO, the World Health Organization. We are definitely taking our cues from the state of Delaware, who's then, is in touch with the CDC and WHO regularly, and we follow those guidelines. And they do have information on there how to stay safe in when this is happening, and the risks that are involved. Certainly with travel. I mean, there are definitely things that are listed out in the list for travel, but knowing that there are other places now in the United States that, have seen a fair amount of COVID-19 positive cases, so that list, may be expanding at some point, I don't know. But that's what we use. We go to the Delaware Division of Public Health and WHO and CDC to always have them with us along the way with our preparedness.
Well, one of the things that came about the state meeting that I listened to today, even though there was a good deal of background noise and so forth, is that we have to be careful that a bunch of patients aren't sent from individual offices or urgent care centers to the emergency room for testing. Because for number one, it's going to overwhelm the emergency system. The other thing is that they're not going to be able to test that many people because right now Delaware has only 300 test kits available.
Yeah, I think they believe more is on the way.
They
and
say
things-
more are on the way, but,
Yeah,
you know.
change. But we definitely, here's the thing, we do need to be very resourceful with our resources. We need to not use up things just because we're kind of, I won't say the word afraid, but maybe we are afraid or we don't have information. There is a hotline that the state of Delaware has, so if you have questions, you can call that hotline. So instead of,
And that number's
buying up-
out at the main desk here too.
Wonderful, yes, and I do have that number if anybody would like it.
Yeah.
But
Can you
we really
share what
should-
it is? Because
There it
we
is.
are streaming this meeting, so
Sure.
that way if people are listening.
Yep. Do you have the cards by chance?
Here's-
And we have cards we can pass out as well.
Okay, here's the number too.
Okay.
This
Well,
is-
we'll get you the number because, and we do also have an email as well. There's the number. I'm sorry. It is 1-866-408-1899. Again, 866-408-1899. Also, what's wonderful is there is an email address. So if you have a question that you don't need an answer right away, but you just have a question, the state of Delaware is monitoring that email. And, it's basically, it's a way to have people getting back to you in a timely fashion, but not an immediate phone call. Because again, we really do want to try to preserve our state's resources and those people that are working very hard to help out. If you don't need a call and you can do the email, it is dphcall, which is CALL, @delaware.gov. So that, they do actually encourage that that the community send those kind of questions to them in that way if they can, or call the hotline number. I mean, the CDC does recommend staying home unless medical care is needed. So just to reiterate what you said.
Well, the other thing that I think we have to consider, particularly when we have a population of, I shouldn't say as elderly folks like myself, that if an employee needs to stay at home to take care of their person at home, their elderly person, that the sick leave be waived as far as up to 14 days so that these people can care for the patient and not become a carrier of the disease. I think that's something that will have to be considered, similar to what the town of Georgetown did. What they've done is they've suggested that, first of all, that patients that are sick with a fever, cough, and shortness of breath stay at home, and that their sick leave would not, or vacation time, would not be encroached upon during this period of time. If it was longer than that, it would require medical documentation. If it's necessary to stay at home with an elderly or sick individual, it also would be covered in that respect. Now, keep in mind that these are recommendations at the town of Georgetown. They have not been implemented because it's not been approved by the town council. But I think that's something that we might want to consider in the city of Lewis, not just for the Lewis employees, but for employers within the city as well. But the other thing that is of concern is that when you call for testing to the state lab, they determine whether the testing is appropriate. And I have some concerns about that, but that's neither here nor there, because we're not going to change it. But they make the decision as to whether testing is appropriate. But with 300 test kits, we can't go too far. Now, Miss Powell has had some experience in India, was it?
Actually, in Washington.
In Washington, with Ebola and the containment. And we thought it would be good to get her perspective to some extent as to how that might relate to this and how we could implement things of a similar nature.
Let me introduce myself. I'm Nancy Powell, former State Department employee, and was the coordinator for both avian influenza and for Ebola. In terms of the State Department working with countries overseas, I also sat in on Ebola as it entered the United States into the White House meetings. I want to emphasize I am not a medical doctor or a medical professional. I'm a diplomat, or was a diplomat. But I would share my experience with you in the following sort of concerns of areas where we really looked that have already been highlighted, but maybe it's worth saying again. The first one is making sure that our medical response teams are protected, that our hospital, our EMT, our physicians are ready and prepared for patients appearing. The hospital that received the first Ebola patient in the United States at Dallas did just about everything they could possibly do wrong. They exposed 15 people to Ebola in what probably should have been maybe one more person. So it's very important that what Bibi has said, what our EMT friend has said, about the training of making sure that they have their professional standards are met, that the personal protective equipment, people know how to use it. They put it on in Dallas, but they put it on wrong, and it was totally ineffective. It did not protect people. The other one, and I realize this is outside the city, but I think it's an area of concern for me at least, are our nursing homes, and making sure that, based on what we're watching in Washington and what has happened in other places, that they don't become petri dishes for infections of either the flu or the coronavirus. The standards that we used, that I'm seeing around on the large meetings, most of them are around 200 or 250 people, and not 500 or 1,000. I'm scheduled to give a speech in San Francisco in a couple weeks, and San Francisco has already banned meetings of more than 200 people in public government places. This one happens to be in a private one, so I'm still
So,
waiting.
Nancy, can I ask a question? So what you're saying is gatherings of up to 200 to 200 are not being discouraged, and it's once you
People
pass
are
those-
being
Okay,
encouraged
It's
to
always a
think
question
it
as to
through.
what the number is. Yeah.
right.
But 200 or more are being actively discouraged or even banned in
Okay.
some places. The third area I would emphasize, and I think this meeting is an example of it, of just getting accurate information out about what is being done, what people can expect, where they can go to if they have questions, the hotline, others. My personal experience and my personal go-to person on TV is Dr. Fauci. He has an incredible ability to take his knowledge and make it understandable, and I have yet to see him skirt the truth. He really seems to be able to communicate that well. But use science-based, not the internet necessarily, or some of the crazy things you see. And the other one is one that we've talked about already, and this is individual responsibility. My father would have called it common sense, of being concerned for other people and not endangering them by appearing if you have disease, doing the elbows, or somebody suggested shaking hands with your feet. There's lots of different ways. My diplomatic service is in a part of the world where that would be very offensive, so I have a little trouble with that. But there are other ways to greet people. We all forget, Dr. Marble and I shook hands when I came up to introduce myself.
We did.
But being really aware, and absolutely the hand washing and the hand sanitizer is critical at this point.
Well, I think you bring up a good point, because we have not addressed the long-term care facilities in our city. They may be at the greatest risk of coronavirus, although to the best of our knowledge, none of them have been involved with that to date. However, I did notice that some of the out of town, particularly Harrison House in Georgetown, has limited visitation. I don't know whether Harbor Healthcare or the moorings have limited visitation or not, but that might be something to consider. And I think that we ought to discourage people who have fever, cough, shortness of breath from visiting at the long-term facilities, and that's something we can do. We can recommend that. We can't enforce it.
Dr. Marble, I know that my emergency preparedness group has been in touch with the long-term care. I don't know to what extent, but they did talk about that just recently on a call that I had at 1 o'clock.
The State of Delaware.
The State
Emergency
of Delaware
Preparedness Group.
Emergency Preparedness Group has been in touch with the nursing homes themselves for long-term care facilities. So I can't speak to what they're, doing with them, but they are involved in the response in the state.
Right. Well, I think that's important, and and I have some information. I only have like a dozen copies, but you're welcome to have them about this. It gives us a little more than we've talked about today. But I think, as far as the Board of Health is concerned, we should consider making some recommendations. And keep in mind that they are pure and simply recommendations. One is that we recommend that gatherings of larger than 200 people be discouraged. And that gatherings of any amount of people, that the people that are sick with a fever, cough, or shortness of breath be discouraged from attending. And that may include such places as our churches and other facilities within the city. We're simply recommending, keep in mind, we're not banning anything, we're just recommending. And we're recommending that consideration be given to liberal vacation and sick time leave for employees within the city, and to include the City of Lewis employees for this coronavirus. And I don't know that we can go much beyond that as far as recommendations are concerned, or we should not, I don't believe. Anne Marie, do you have any thoughts?
So you've got discouraging, these mics are just funky, discouraging gatherings of 250 plus, and then for gatherings with less than that, if people are not feeling well, stay home. That's
correct. And then
Oh, did you say 200 or 250? 200, sorry about that.
And then the liberal
The
vacation
liberal leave.
and sick time leave.
I like what Georgetown has, so, I can certainly work to draft something up that would,
Apparently, they use their solicitor to.
Okay.
We could use Mr. Mandelis to help us, I guess.
or we can just borrow theirs.
Yes.
Do a find and replace, Georgetown to Lewis?
Yeah, Ted Becker sent me this morning, so it's
So,
hot
yeah,
off the
I mean,
press.
and I can call their town manager and
Yeah.
talk about, how they went through approval.
Are there any other questions from the audience or comments? Yes, sir.
Mark Harris at St. Peter's here in Lewis. There's been considerable conversation about people self-quarantining if they are sick or feeling sick. And certainly if they have been diagnosed with the virus, but it's not a horrible case that requires that they be in the hospital. Self-quarantining seems to be one of the options that's available. In a town like ours, where we have a fairly large number of older citizens, of whom I'm to be numbered, one of the questions that comes up then is, how do we care for those who have self-quarantined? And it would be helpful at some point, it may not come to this, I hope it doesn't, but it would be helpful at some point to have some suggestions or directives about things that we can do to help one another. For example, if I'm quarantined and I've quarantined myself and I'm not going out, and I am in fact in need of either drugs from the drugstore or food from the food store or whatever, right? The kinds of recommendations about how someone could help me without being exposed to what I have. So for example, I phone them on the phone and I say, I'd like to have some groceries delivered. Could you deliver them? And they come and leave them on the front porch, and I go out on the front porch and bring them in. Or just, I mean, they sound like really simple kinds of how do we care for each other in a time where we're not allowed, or we shouldn't be in close proximity to one another. How do we make use of really simple means of communications in order to sort of overcome that and to be able to connect with one another and take care of one another? At some point, it'd be interesting to have something from health experts about how you do this exchange without further complicating the transmission of the virus.
The CDC does have some information on its website about
Yep.
people who are quarantined and those who are actually even in the same household with them, because those folks are at higher risk. And they do have some information there. I mean, I know you're about the creativity of certainly like people coming and bringing things to the home, but I believe it does have measures of if you do need to interact with someone, how to do that safely.
Well, okay, that's great. The question has to do with is how we disseminate that kind of information. For example, putting things on the website is not useful, in the sense that there's an awful lot of people who are not going to know that they should go to a particular website, like having the information about this meeting today. It's on the website, but what do you do about people who don't regularly consult websites, right?
Right.
So the kind of question might come down to sort of something where the town could send a note around by mail to everyone's home at some point, if it was a useful thing to do, that had some of the kind of basic information and also where to go for further information.
Well, just in that vein, we do have our Code Red system that we can use if we can, and perhaps I could work with the two of you, I'm thinking, to craft a message that would be what we want the people here to know. If you're not feeling well, stay home. If you have the symptoms, get tested. I mean, we do want people to go to the doctor if they're having the symptoms, right?
Not necessarily.
No, not necessarily.
Oh.
It's that they need medical care. So because there's no actual cure for this, it's more, it's being supported while you're getting over the illness.
Okay.
So for curiosity's sake, just to get tested, again, that may deplete supplies, and then you're
Okay.
also out in the community potentially exposing others.
Okay.
Potentially exposing others that are actually more ill for other reasons that are there with you.
So if you're not feeling well, stay home, period.
Unless you need
Unless you
medical
need
care.
medical
If you
attention.
do need medical care, you do need to seek medical care with your physician, your primary care physician,
Okay.
and go from there. But again, that's where the hotline's great, because they have someone that'll answer and kind of walk
Right.
through that with you and ask you certain questions and sort of help with a screening of sorts.
So if we could craft like a 2-minute message that we could say, these are the things that you should be aware of, and give them the hotline. That way, a
Right.
robocall goes out, everybody hears the same thing.
I think that's a good
And-
idea.
If I may, Christina, she is our public relations person. She has done a fantastic job about getting all of our external communications and our internal communications. She has great ideas and resources, and I'm sure she may be able to help us too.
Okay.
If I could speak, my name is Jane Thompson. I'm not a medical person, but because of the breathing problems I have, I'm very susceptible, to this, this COVID-19 virus. But on a personal level, what I've done with two of my friends, one's a nurse and my sister, I have contacted them to make sure that they have my cell phone numbers, on their phones, should I have to call them. I've also told them if I'm allergic to any foods, in case they have to bring some foods. I've also told them where I get my medicines. I use Rite Aid here in Lewis. I've told them who my doctors are, if they should need to call a doctor, if I should get too sick. And I think, also through the church, maybe you could work something with some of your parishioners who would like to work together and, if each one maybe just give somebody 3 names. And we call and check on each other all the time, whether we're sick or not, just to make sure that we're okay. This virus is age 30 to 79. I'm in there, Dr. Marble, he's in there. And so it's nice to just have somebody check on you once in a while. And, should I need some medicines, they can call my doctor. My doctor knows that my sister might call, or my best friend, who is also a nurse, might call, and then that she could, leave them at the door, for me to get. And so we have a good communication system there. Because as you said, not everyone, can get on the internet or has the capability or even feels like getting on the internet, at that time.
Well, I think too, one of the things that Nancy brought up was the fact that Dr. Fossey is a very truthful and forthcoming physician. Unfortunately, if you pick up the newspaper and so forth, you see former so-and-so is giving advice. I don't know that that's something that should be taken at full value. I think somebody like information from Dr. Fossey should be taken at full value. Would you agree, Nancy? Some of these are, former this, former that. They're not involved in the day-to-day activities at this point, so what difference does it make? I don't think so. But I think a lot of these things now, I have noticed that some of the grocery stores locally will deliver groceries, so that I think that might be publicized as well, but I've seen it advertised that they will. And I noticed out here, I shop out there, Weiss Markets, I see the girl going around shopping with a cart, with a list that she's picking up, and then the people stop by. I don't know whether they deliver, but I do see the cars pull up out front and they load them up with their groceries.
Some of them
They
do
do deliver?
Sometimes you have to give them 24 hours
Yeah.
notice. But I think something we could do would maybe have a list of volunteers, because I think a lot of people would volunteer to help. And if we had a list of names and numbers, that might work.
Right, we can work on that.
But the grocery store, the main thing there is the exchange of money. So that if they place the order with the grocery store, they could do it with a credit card. There
Well,
would be no exchange of money.
you do see that there's a bill in the Delaware legislature to ban cashless stores in the state of Delaware. But we'll see what happens to that. But, yeah, we can do it with a credit card, or maybe they'd take the credit card over the phone.
Yeah,
Yeah.
they would.
You see, they wouldn't have to be handling of the credit card and,
Because the
contact
drivers
between.
aren't like the pizza drivers and all.
Yeah.
From what I understand, the grocery, you have to, when you place the order, you pay for it with either your debit or credit card
Yeah.
at that time.
Glenn had something, I think.
So this is a good time to remind everybody, there's a couple of mechanisms that have been around for some time to get information out, and Beebe's been amazing with one. It's called the File of Life, which is a handwritten product. You get a red sticker with white print. It goes on your front door or front window. It has a magnet pouch that goes on your refrigerator with a fold-out information, paper that you put all your medical information, contact information. So we know, first responders know, we see that, we're going to your refrigerator. We're not going to get something to eat, we're gonna go see what your medical situation is. Right, so for those that are not technically savvy or don't wanna go that route, that's there. It's readily available. All of our people for, all of our units in Sussex County EMS have them on board. Most of the BLS units around the area carry them. BB has a stockpile. The other is technological, and it's called Smart 911. And that's been around for a good couple of years, and you can go online and put all your information in there, and it remains intact, dormant, until you call 911, and then it is only available to the crew that's responding, and that's for a 30-minute time frame, and you can update that however you want. So if you have a concern, if you have somebody that wants to be, you want to be your point of contact, you want to tell them where your hide key, what your medical information is, things along those lines. It's a great resource. So this helps us when we come in the door or before we even get there in the case of Smart 911, because it pops up and it allows us to notify the receiving facility. So the more advance notice everybody has, the more effective we are in getting you to the appropriate facility and getting you the appropriate care. So it's a great
Thank you, Glenn.
opportunity to remind those.
That's a good thought. Any other comments from the audience?
Rob Morgan, East Cape Shores Drive. It just struck me that this is, you've been a source of good information and good ideas, and it's likely that your value will continue. Have you thought about scheduling a follow-up meeting?
I think we should.
And
Yes.
I might note that the requirement for posting notices of meetings 7 days in advance, which is statutory, doesn't apply to any emergency meeting which is necessary for the immediate preservation
Oh,
of
is
the
that
public
correct?
peace, health, or safety. So in other words, you can do it.
Right. Thank you very much.
Thank you.
Appreciate
I
it.
think it's still 24 hours.
No.
It isn't even?
doesn't apply at all.
Okay.
Emergency. Yes.
I just want to bring something up. My name is Lee Parks. I have a son that's in South Korea right now. He's in the middle of all this COVID-19. He's in the military. His base has been shut down. It started in Daegu, as you may have all read. It started off with a church. Some of the people from the church got this virus, started getting it spread. Biggest thing is, don't panic. For a month and a half now, his family's been quarantined, self-quarantined inside. I have 2 small grandchildren over there. I have my daughter-in-law, my son. He can go to work once in a while on the base, but he's not allowed to go anywhere else. The family can't go anywhere. He does find out which military people have self-quarantined, and he takes groceries over to them and does exactly what you've suggested, place it in front of the doorstep, and then they take it in. As a mom, having a son that's in the middle of this, I can understand where the fear is, but just know it's okay. You know, I'm not fearful. I know he's being taken care of. I know that they've got restrictions put in place. I know that this is all going to end sometime soon. This isn't going to go on for a long time. I just want you to know that as somebody who's right in the middle of this, it's going to be okay.
Thank you.
And just, you know, don't be fearful of something that you don't need to be fearful of.
Thank you very much. Yes, ma'am.
wasn't even gonna bring this up, but, my name's Patty Marble. I was walking in town earlier this morning, and I, encountered two people walking down Second Street wearing masks. So, social media. All right, there's a lot of fake news on social media. Probably a lot of real news on social media as well. I guess my question to you, Mrs. Hoppel, would be, does a mask really do anything? Because I've seen sites that say they do nothing to prevent this, and I've seen sites that say they do. But then what happens when there are no masks left? Because hospitals are, I mean, I'm sure masks are important to your job, and as well as EMS as well.
Yes.
But I just don't want to see a whole town walking around with masks on if it's really not necessary.
So the issue with masks is that there are certain kinds that we use in the medical field that you actually have to be fit tested for. And if you're not fit tested for the right size, it's not really going to do anything for you. The 3M masks that are the contractor ones, and that I've seen people wear too, they are not effective towards, and this comes from the CDC, that those particular type are not either. You know, people are kind of do what they'd like to do or what they think is helpful. But I think that we need to listen to the experts on this, and the hand washing, the staying away from people if you're sick, those types of things are the things that we need to concentrate on. The things that have worked for us in the flu, and you know, if we had these, you know, if everybody did what they're supposed to do during the flu time, that would be very helpful too. So, you know, I mean, if we did hand washing like we're supposed to, stay home if you're sick, you know, we see the flu stuff all the time. You know, following those recommendations is what we need to be doing.
So if I were to walk in the hospital, they're not going to hand me a mask.
Well, that would depend. So what
That
CDC
depends,
and
yes.
WHO, I believe, have said is that just wearing a mask around outside doesn't do anything. As a matter of fact, sometimes it can actually give people a false sense of security. And people are fiddling with the mask and touching their face, and that's what you're not supposed to be doing. Sometimes they wear it low. We've seen people take their mask off to talk to people and put it back on. It's really not
We've seen
effective
that.
in that way.
Yeah.
But masks are effective in other ways. So certainly they do help, and at this point, you know, with surgical masks, they do help if, you know, there's someone who's under suspicion for that. That is part of our personal protective equipment, PPE, that if someone comes in and then say that they have presented with, again, respiratory symptoms, it could be influenza, RSV, we don't know what it could be, then the healthcare provider would ask them to put that person to put a mask on, and then of course the healthcare provider would then also put all the personal protective equipment needed, depending on the situation.
And I'd like to thank everyone for taking the time to present us with all this useful information.
And another thing along that same line with the mask, because first thing you know, there aren't going to be any, the disinfectant wipes. Everybody's hoarding these, so that when people go to buy them, if everybody would buy some, but not a dozen containers, you know, and then there's none left for anybody else.
You know, I hate to sound like Donald Trump, but we're all concerned about COVID-19, yet the flu in Delaware is much more prevalent. There have been over 15,000 cases of flu documented in the state of Delaware this year. And I think we need to keep that in mind as well. And the other thing to realize is that flu kills about 0.1% of the population that's affected. COVID-19 may kill 1 to 4%, but the numbers are lower for the COVID-19 involvement so far. And I think what Mr. Morgan suggested, that having a follow-up meeting to this would be quite helpful. I would say somewhere within 2 weeks, or maybe 2 weeks from now.
Okay.
So we could follow up with it. Does that seem satisfactory?
I think that would be fine, so we can select a date for that now if you all have your calendars. There were a couple things I did want to bring up. The mayor has has made some suggestions. One is that we reach out to the Greater Lewis Community Village because they do provide that service to a large part of our population of helping with those tasks, get information out through the library, and that we also reach out to the HOAs because they tend to have very good email lists. So whatever statement or whatever we put together, we can come up with something we can send through Code Red where people would get a
I think
phone call, but we can put it out
Some of
through
those
other venues.
Homeowners association go to find they're outside the city of Lewis. I don't know.
Right.
I don't know whether we want to try to invade the outer limits of
Well,
the city of Lewis
we do
or not. I
maintain a
don't know.
list, we maintain a list of the contacts for homeowner associations in Lewis, so
In
we do
Lewis,
have
yeah.
that.
And it's not the Lewis Greater Community thing. It has a new name. I just saw that in the paper. Village something.
Oh,
The Greater Lewis Civic Coalition,
That-
which used to be the Lewis Homeowners Association, we have a broader list
Right.
of Greater Lewis HOAs too.
Right. Yes, sir.
John Michael Self is a member of St. Peter's, and I'm one of those people that lives outside the city of Lewis. I am not a resident of the city limits, but I consider myself a Lewis resident.
Right.
I think it would be very helpful if whatever you all adopted, whatever the city council agrees with out of your recommendations, that you share it with your counterparts in the county government. Just like Georgetown has shared their recommendations with you today, I don't think there'd be any problem. I don't know anybody at that point on the council, on this county council, but I don't think there'd be any problem. I think they'd be very receptive to anything you could share with them.
Thank you.
And BB would be happy, we've already shared information, we'd be happy to share with you what we've already shared, with others, be it through our website or from statements, et cetera, so.
Yes.
But it's really all based on the CDC guidelines.
Yes, ma'am.
WHO guidelines.
Hi, Rebecca Lowe from the Lewis Public Library. So, shout out to the library. We are willing to help in whatever way. So you were talking about things that to be distributed, that BB had them and you guys have them. I mean, somebody may not be comfortable going to BB for fear that they might get exposed, but if, the library could have things that people could come pick up. I mean, we have over 600 people a day walk through our doors, so, I mean, that can be.
We actually have some with us. I think we have enough for everyone in this room. We have actual little cards. We call them COVID information cards.
Yeah, we have a
So,
COVID display
yeah, they
set
can
up
take that
right when you
right
walk
with them.
into the
they
facility.
can take
So
that.
if, anything you have that you want people
Great.
to be able to take away, we can do that for you. As well as, we have an email list. It's almost 5,000 names. I mean, it's not limited to Lewis, it's the surrounding areas. So if you have information you need us to send out, we can do that as well. One question I have is about the gatherings, because as you know from speaking with my buddy back there, we have several large events coming up that are planned. So at what point, what's the timeline for making the decision on, yes, we are going to say things are discouraged or things are banned and what the numbers are? And just to give us who plan events and who hold events, I mean, it's one thing to tell, right now we're telling people, we're doing whatever Department of Health and Human Services tells us, whatever the Delaware Division of Library tells us. We're looking at what other libraries our size are doing, and asking people to do what's in their best interest. I mean, if you feel like you should not be around other people, then yes, please stay at home. But what's the point at which we're going to be telling people, well, we're canceling any public gathering?
Right, so what I'm looking, I've got three of our council people are here, and we actually have a budget meeting scheduled for Friday morning at 9. And I was wondering if we want to immediately, or starting at 9 so the budget meeting could proceed immediately after, schedule a special council meeting so that council can act on the board's recommendations.
Why do we have to wait? Why can't we do it Monday? Our regular meeting.
I mean, it could be Monday.
This is an emergency, we're saying. I think we can put it on Monday's agenda. I don't see waiting.
We could certainly put it on Monday's agenda. I was wondering if we wanted to do it before then.
Friday, we're gonna meet Friday.
Right,
Then council meets Monday.
right. So, but you all could make a decision on Friday if you want.
Friday, and we can do it Monday.
We got,
That's what I would do.
As
oops.
a civic organization hosting a large event, I have over 600 people coming to hear Eric Larson. You help me keep those people out of that room if that man is there, because, oh my gosh, he's #1 on the New York Times bestseller list right now. Everybody's really excited. If we're not gonna host him, I need something definitive.
Right,
and I need
and if you don't mind, I
letter.
would like to say something about what the CDC does say, and this is right from the CDC. It does say avoid crowds, especially in poorly ventilated spaces. Your risk of exposure to respiratory viruses like COVID-19 may increase in crowded, closed-in settings with little air circulation if there are people in the crowd who are sick. So I just wanted to make sure everybody had that information.
Hi, I'm Bonnie Osler, 901 Savannah Road. I do not have the flu, I just have a bad cold, so no panic, I just have a bad cold. Because I did call and say, hey, I've got this, 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 and this, and they said, no, your temperature isn't high enough, you don't have the flu. I said, great. Here is my question. I'm a member of council, and I agree that we should meet as soon as practical. And I think the mayor isn't back until
No, but he's
Friday.
texting me, he's listening.
Okay, good.
So he's-
Hi, Ted. But I do think we should act as quickly as possible. I do have one question, though, which is, I believe that the recommendation from this board going up to council had a limit of 200 people or more. And I'm getting emails constantly about things that are canceled or suspended or whatever that involve gatherings of far fewer than 200 people. And I'm just wondering, now we have, another number. I'm wondering what the basis is for that 200-person limit, because my understanding, to your point, is, say we have the city council meeting on Monday. If we have it, and we anticipate a lot of people will be interested, it's going to be in a room that is crowded. Social distancing, which I gather is somewhere between 6 and 8 feet away from everybody else, will be impossible. So my question is it a numeric cutoff? Is it a safety cutoff? How do we judge what kind of gatherings? I mean, a run, right, you could probably have in as many people as you wanted because they're going to be apart from one another. But a meeting in a closed area, how do we, is a number what we should be looking at? Or is it a series of circumstances that we should be looking at? Just to guide how the council should work on it. So, thank you.
Keep in mind that these coming from us are simply recommendations. And if the council will have to act on that, and accept or reject and so forth. And I think we ought to set another meeting for Wednesday, the 25th, if that, is that satisfactory to everybody? At 1:30 again? Does that be all right, Amber?
Sure. I'm checking just to make sure there's nothing else on the. Oh, Byways is scheduled to meet in here. Could we do it in the morning, perhaps?
I would think so. I don't have any objection.
Could we do it at like 10:30, 10 o'clock?
I can.
Yeah,
What,
10:30.
We have a
10:30.
state call at 11 o'clock.
Huh?
Oh.
The state call is at 11 o'clock that day, because they're on Wednesdays.
A what?
State call,
The
the state
state
call.
call that he's
Yeah,
involved in.
that's the
I'm
one.
involved
If
in.
we do it at 10, would that,
Well, I think that there's a benefit to this being after the state call, right?
Yeah.
So, I mean, I'm sure Mary Roth would understand,
Shane's at Byways.
that maybe we say, what if we were to meet at 1, and I ask the Byways Committee to start an hour late?
I would think that would be all right. Is that all right with everybody? One,
Okay.
I'm just, sorry, I'm really curious how often the state is having calls.
It depends on the topic. So the one from the Department of the Public Health call is on once a week on Wednesdays at 1 o'clock, at 11 o'clock. But there are many other calls happening with, again, many other areas. There's the preparedness calls. There's multiple branches of the state talking with multiple people all throughout the week. And also as we have ad hoc calls. So when something new comes, there's a new change from CDC or WHO or something else, they set up a call. So this is the only one that we know for us that happens on a regular basis for our team, but there are other calls with others, so.
I have some extra copies of this material that's come from some from the state, some from the CDC. If anybody would like them, please feel free. Yes, sir. Oh, I'm sorry. Go ahead.
Mark Harris again. The question that was raised about numbers of people and the possibility of not just advice, but in some parts of the country, things have been outright banned by some agency of government. Mostly, I gather, on the level of state government. Although I don't know whether some particular mayors might in fact have that kind of power or not. But the question about either the state of Delaware or the mayor of the city or some agency has the power to, I gather, to prohibit meetings of particular sizes.
I think that would come if the governor declares a state of emergency, which he has not done.
Right.
Okay, is that the only agency in the state of Delaware?
So under the emergency operations plan, I believe that the mayor could actually do a declaration.
Okay, so the question about an outright ban of meetings obviously is not yet, immediately an issue, but when it becomes an issue, it becomes an issue because either the city or the state has made a declaration of some sort, is that right?
Mm-hmm.
Okay, so does that deal with the question about outright bans, or?
It's not that I'm worried about a ban, it's just that I want clear direction.
Right.
I'm looking for clear direction.
No clear direction.
And when exactly is the event, Jen?
St. Patrick's Day.
So it's Tuesday is the first. So if council meets on Friday morning at 9 and does this before we have the budget, then that, we will be able to provide that guidance by then.
And maybe by then, the state will have made a
Right.
decision about some guidance.
So I can tell you that on my call at 1 o'clock, I had 2 state calls today. The state gave the indication, public health, said that the expectation probably is that the state of Delaware, when the first patient is identified, that they will issue a state of emergency because, for those of you who don't understand that, that provides funding. It opens up different avenues for the state to be able to get help. So that was their expectation. Now, of course, it's up to them, but they did tell us that on the call, that you heard that too, that was their expectation.
So what I would like to remind everybody is I've heard emergency thrown around here quite a bit today. We're not at that level. Okay, we're informational. It's urgent that we get information out.
Mm-hmm.
The other thing, if you're having a gathering of any size and you're in a situation where you have limited ventilation and you have a suspicion, it's just like we're telling you to be proactive in your self-care. What is the value of that actual gathering compared to the possibility of exposing others? So even if you fall outside of the town limits or there's nothing, if you're going to be diligent in limiting the passing of the disease, there needs to be some self-responsibility and an assessment, self-assessment or group assessment of the gathering. So, the state and everybody involved in it, from the emergency responder level all the way up to the hospitals and the state health department, are well-versed and staying current regularly. And that will change things, but part of what drives this is, and if you look at the areas that have been effective, truly to the point of there's bans on large gatherings, it's been based on large gatherings or travel. So those are the two biggest common factors. Right, close space environment and travel, which again, you're in close space confinement.
And the cruise ship checks both of those boxes.
Yes, it
I
does.
think a lot of this is common sense also. Yes, ma'am.
Brooke Hedge. I just want to let you know that if you go to delaware.gov, if you don't already know it, there is a virtual town hall meeting tonight with Governor Carney and Secretary Walker, and you can send any questions you have to townhall@delaware.gov. I think it starts at 7. You can watch it online. I've already sent a question asking how do you determine whether to cancel an event, by numbers, by environment. So we'll see.
I would just add one other category to that of looking at who your attendance is.
Know your audience.
What's your demographic? Are they 65 and over? Most of them have hypertension. Most of them have some heart issues. They smoked. What's your group? It could be 5 people, but if they all have congestive heart failure, that may be not a good meeting to have. If you've got 200 mile runners out at Cape Henlopen, probably they're okay. You have to kind of think this through a little bit.
I think that's, the other thing that was brought up in that state call that I got parts of this morning or noontime, was they asked about whether there are plans for any testing of juveniles. And they mentioned that AI DuPont and the Moores Foundation might be involved in that. But my understanding is that for some reason or other, children and juveniles below the age of 18 seem to have some sort of protection against this. But I don't think that's clear cut. But I don't know that there's been any recommendations regarding children. And there are no children. The youngest tested individual that I saw was age 24.
So I've got a question as it relates to gatherings, and this kind of goes to some of what Glenn said and also what Nancy said. That, two kind of groups of gatherings have been talked about. We've got a council meeting Monday night where we're expecting a large turnout. Demographically, we know we're going to be a lot of people over 60. However, they're typically going to be Delaware people who are coming from Delaware locations. I'm not sure, Jen, what your audience is, and I'm wondering it strikes me that since we don't have any diagnosed cases at this point in Delaware, that the risk is higher if it's an event that's drawing from other locations.
I agree.
Is that?
Well, the only thing is with that Monday meeting, there are attorneys that come from all over, and there are a lot of people that attend that meeting that do not live here full-time.
Okay.
So that you do have a lot of people coming from different places.
Right.
And there is already something here on that night. I'll show you.
What do you?
Because my granddaughter's on that.
Oh, no, that actually is at the council meeting. So we need to make sure they don't know that this.
Well, I know, but you were talking about changing that to here.
No, but this is part of the council meeting. This presentation is part of the council meeting, so right now they have the wrong location.
Oh, so it's going to be there too?
Yes. So it's all the council meeting. And I guess the other question I have is, again, we don't know how long this is going to go. So if we cancel now when we have no cases in Delaware, and then we have an April council meeting, and suddenly we do have cases, at what point do we end up then going for a very long time without the city doing the business of running the city? And that's kind of my concern about canceling before we have
I think all those things have to be taken into consideration.
Right.
Well, I really want to thank everybody for, yes, ma'am.
I have these resources that we brought for folks to take with them. Should I put them over?
Should.
If you put them up on one of the tables, people can grab.
outside?
You can put them up here and that way.
Thank you. And these are those things that I spoke about, too.
Yep, this is a little card that's got the state resources as well as CDC on the back that BB made for you. And these are simply printed from the state DPH website. This is how to protect yourself. And this is just a larger version of the DPH's call center and their email.
Thank you very much.
You're welcome.
thank you all for attending. I think it's been quite an informative meeting, and I hope that something will come of it.
Yeah, the
Thank you.
population health staff is in there. Let me, I'll email you the number, okay? I think it's Rebecca you can talk to, but let me see who